ourselves as a profession. The foundation of the PA profession is one of caring. We care, not just about our patients, but also about those who will never, ever visit our clinics. When the call went out for aid following the devastating earthquake in Haiti, AAPA offices were flooded with calls from PAs who wanted to help. PAs were well represented among medical responders to the disaster. Many of them were called out on short notice, left their jobs and families behind to travel to a place where they knew their skills were needed. They were not required to do this. They did it because they saw the chance to bring a few moments of comfort to those who had literally lost everything. Hundreds of PAs take part in such giving throughout the year, both at home and abroad. Whether they involve travel to a foreign country or something as simple as spending a few hours screening and educating locals in an underserved area about diabetes. All of those selfless acts make our foundation stronger. The founders of our profession knew that we would be in a position to lead, to innovate, and to inspire. We are now moving into a leadership role in healthcare, and we are ready to do great things. Dr. Stead once wrote, "PAs sought and found the opportunity to see people in a way nobody else but a doctor had ever envisioned." PAs have the ability to take that and parlay it into all kinds of ventures in business, industry, and law. And all that remains is for each PA to seize the opportunity. I'll close with a statement that I first heard Dr. Regina Benjamin make in a speech to PA leaders in early 2009. This was after she had been nominated as Surgeon General of the United States. As many of you know, Dr. Benjamin practices in a clinic in Bayou La Batterie, Alabama, one of the poorest parishes in America. And her PA is there now, keeping the clinic operating while she's in Washington serving us all as America's physician. Dr. Benjamin said, "PAs are bigger than a profession. You are a movement with the potential to fulfill the promise of healthcare." Never forget that. Together, we are a movement that will fulfill the promise of healthcare. It is my sincere hope that during the past year, I have been able to build on the tradition of innovative healthcare delivery and patient care that has defined the PA profession. Serving as AAPA president has truly been a humbling experience, and I thank you for the opportunity to do so as we stand on a new era in healthcare delivery. I would also like to thank my wife, Judy, who is here today, and my family, who have supported my leadership activities over many years, and my mother, who is terminally ill and couldn't travel here today. Thank you, and I hope you enjoy your time at Impact 2010. Thank you. Thank you. Thank you very much. Without our next speaker, my job over the past year would have been much more difficult, if not impossible. His knowledge and contributions have been indispensable in helping AAPA to develop the strategies behind our successes over the past year. Please welcome AAPA Executive Vice President and CEO, Bill Leinweber.
Good morning. Welcome to Atlanta. It's great to be with you again. It seems like we were just in San Diego. These years go by oh too quickly. I was speaking with some colleagues the other day who were recounting this being their 30th, 25th, 35th AAPA conference, and this is a ritual that's easy and a pleasure to get used to, and it's really wonderful to be with you. As Steve alluded, it has indeed been a dynamic year for healthcare and for the PA profession. It doesn't seem that long ago that we were in San Diego, and at that point, we were launching a new brand for the Academy, introducing that to you all for the first time, and discussing what at that time were emerging ruminations as to what a reformed healthcare system might look like for the country. We knew that PAs would become more visible as healthcare reform evolved and as the legislative process moved forward. As it moved forward, PAs were called on for their input, and we worked hard to make sure you were called on for your input and recognized for your contributions. And healthcare reform is a good starting point for some of the remarks that I'd like to share with you this morning, since it represents both the dawn of a new era in the delivery of quality health care and a challenge for all healthcare providers and for the patients that you serve every day. However you feel about the new law, and to be clear, we have a wide range of feelings about this law across the country, and our organization is a microcosm of that country. There are a wide, disparate feelings about the law and how it will be implemented. But however you feel about it, it's safe to say that all PAs and all of the patients that you serve will be affected by it. First, let me say and let me echo Steve's remarks that without the support and participation of PAs from across the country, PAs just like you sitting here with us in Atlanta this morning, PAs giving up their time to meet with legislators, to send emails, to make phone calls, to participate in visits in Washington, to participate in congressional district visits, visits in your backyard with staff of congressional leaders. Without all of that, AAPA's job in helping shape those elements of the legislation affecting PAs would have been a great deal more difficult, if not in fact impossible. We thank you for all of your support, for all of your advocacy. You are advocates. As a PA, I always say when I talk to folks across the country, your work as PAs doesn't begin and end in the treatment of the patients that you care for. To really extend the full reach of medicine and the promise of health, advocacy also must be part of your mission. Our efforts were guided by a commitment to work with Congress to enact healthcare reform that meets the needs of the American people and that encompass the Academy's healthcare reform principles, principles that were approved by the AAPA House of Delegates, affirmed and reaffirmed on several occasions. Let's review what our principles for healthcare reform include. They include access to quality, affordable, cost-effective care for all Americans, the use of evidence-based medicine, physician-directed teams of healthcare providers, and optimal utilization of primary care. Our principles also stress an emphasis on health promotion and disease prevention. They include medical liability reform that treats both patients and providers equitably and encourages healthcare providers, such as yourselves, to apologize for an adverse event without increasing risk, a novel concept in our litigious society. And our principles support sustainable financing and payment mechanisms that consider what is learned through comparative effectiveness research.